Counseling for Change: Complementary and Alternative Approaches to Psychotherapy by Fatima Muhammad. I was sparked to do research on alternative therapy approaches after viewing the American Shaman video by Dr. Bradford Keeney. It was then that I realized that there were alternative psychotherapy approaches in working with clients. Although his methods were a little bit radical, I thought it was rather interesting that he added in a spiritual component. In researching, I found that there was a whole field dedicated to alternative methods of treating clients. There are, in fact, institutions and associations directed towards natural and holistic methods of practicing natural medicines and therapies. Upon doing research, I discovered complementary and alternative medicines, also known as CAMs. CAM seeks to incorporate a holistic approach to therapy. CAM utilizes more of an Eastern approach to treating clients mentally and medically. However, I decided to narrow my research even further by really honing in on addressing spiritual and religious needs in psychotherapy. And I hope that by the end of this presentation, therapists will be well informed on CAM methods and how to integrate them into your sessions. Spirituality. Emory University is one of the very few schools that incorporate religion and psychotherapy. Where many other universities expound upon cultural diversity and how to appeal to social and ecological needs of a client, they often leave out how to effectively incorporate and treat a client's spiritual needs. For purposes of this presentation, I will mostly focus on Christianity when discussing religion and spirituality more so in a general sense. In an article entitled Spiritual Transformation: Honoring Spiritual Traditions in Psychotherapy by Frederick defined spirituality from previous research as being separate from religion and having mystical or divine experiences that involved an interconnectedness of life and dogma. He also shared that it can include meditation, scripture reading, prayer, and studying on how behavior is in correlation with relationships. He further goes to discuss Christian spirituality, and he characterizes that by Christian discipleship, as well as being more Christ-like. Despite him reporting on how meditation and scripture reading and practices of those nature were more on a spiritual sense, I just wanted to put, as a common factor that these practices are also highly practiced in other religions all across the world. So, mental health professionals. I decided to compose a list of few mental health professionals that we might be familiar with, such as professional counselors, MFTs, clinical social workers, psychologists, and psychiatrists. These clinicians, of course, may have clients that they treat with spiritual or religious issues, as some of them may even have certifications as Christian counselors. However, if they do not have a specific certification or background dealing with religion and spirituality, they may use their knowledge of what they learned in their cultural diversity class. Clinicians may research the client's beliefs along with taking a one-down stance and allowing the client to educate them about their culture. Well, this same practice can essentially be done with religion. A clinician can do research about the client's religion as well as ask the client questions about how they practice their religion. However, a clinician will have to seek guidance from their clients when it comes to spirituality, as spirituality may not be driven by specific doctrines. And here I just wanted to include a special little picture just showing the different type of religions that are shown in the world. So, continuing on with religion and spirituality, we've just briefly discussed different types of mental health therapists, but now I would like to discuss other religious treatments and the various professionals that are involved. Many of our professors at Amherst University have discussed that they were pastors before, deciding to go to school to learn more about the counseling side of things. They shared that they were able to, see clients in the church and that, they realized that some of these church members actually had mental health issues that they may not have been equipped to handle at the time. I believe it is becoming more prevalent in the last few years that other pastors as well are starting to realize that they may not have all the tools they need to effectively treat people with mental health diseases and diagnoses. I even discovered at my own church that they partnered up with a university to allow Christian counselors to come in, which were graduate students, to also work with our church members. So I found a journal called Varieties of Religious and Spiritual Treatment, Spirituality Oriented Psychotherapy and Beyond by Sperry. And Sperry reported on 5 different types of religious and spiritual treatments that were conducted by either chaplains or mental health therapists, such as pastoral care, pastoral counseling, spiritual direction, and more conventional methods such as spiritually oriented psychotherapy, which is what we MFTs might, even be interested in practicing, and spiritual care. With pastoral care, they mainly focus on religious and spiritual distress, and it's more so conducted outside of formal counseling or in addition to psychotherapy. So it may be something that, a church member will go to kind of as a pre-counseling to talk about their spiritual or religious stresses or changes. And they may just start there before being referred to a mental health therapist. Pastoral counseling. Pastoral counseling promotes overall balance of physical, emotional, moral, and religious stressors. And this might be your pastor who actually decided to go to school and become, a professional and get a background in pastoral counseling, in which his aim would be to focus on spiritual growth and balance. Spiritual care. Spiritual care can be practice with non-chaplain clinicians. It could be mental health clinicians, or it could be a pastoral counselor as well. And so with spiritual care, it involves 4 functions such as taking a spiritual assessment, including the individual's spiritual beliefs, practices, and involvement in religious community, and identifying spiritual needs, ensuring that these needs are addressed by someone, and providing mental health care in a spiritual way. So continuing on with the journal, Sperry also reported on spiritual direction. In spiritual direction, you can receive a master's degree in mental health counseling. And it's mostly commonly practiced in Catholicism, but they're also known to be practiced with Christianity, Buddhism, and Judaism. The primary focus is spiritual growth, and the secondary is more on a psychological health. They use it more in a psychotherapy approach in terms of, how they handle the sessions, but they don't necessarily use psychopathology or do diagnoses and such. Spiritually oriented psychotherapy. Spiritually oriented psychotherapy can be practiced by mental health clinicians as well as pastoral counselors. The primary goal is psychological change, and the secondary goal is spiritual change. The goal is to decrease stress and restore to baseline functioning. Unlike the other treatments mentioned, it uses psychotherapeutic and psychospiritual interventions, such as meditation, prayer, and spiritual practices. And in this type of therapy, they also collaborate with the clergy and chaplains of the churches. Now we'll be moving on to complementary and alternative medicines, also known as CAM. Complementary and alternative medicines are non-traditional methods of aiding clients in mental health and medical health. Complementary methods may be anything outside of formal psychotherapy, such as energy healing methods, and alternative medicines such as teas, herbal remedies, plants may be utilized rather than prescription drugs or medicines prescribed by a psychiatrist. Also, I have a nice little quote here from College and Associates where he talks about complementary and alternative therapies are used by two-thirds of Americans, 3 out of 10 are pre-baby boomers, 5 out of 10 are baby boomers, and 7 out of 10 are post-baby boomers, with increasing use across all major socio-demographic groups. And I have a nice little video that I would like to show you that also demonstrates a little bit more about what complementary and alternative medicines are.